And Press Secretary Dana Perino said that this expansion is a move towards socialized type medicine. If this is a move towards socialized type medicine, why stop at a veto? Why not get rid of the whole program?
The President's position on this can be summarized in 3 words. Poor children first. Poor children ought to have health insurance before we begin to focus on adults. They ought to have it before we start focusing on middle-income families. The President just thinks it's wrong that some, under this bill, could receive public subsidy for their health insurance as high as $83,000 in their family. We would be encouraging people who currently have insurance to cancel it so that the government can pay for it. Now, the President has put forward a plan to have every American have health insurance and wants to get onto that debate. Every presidential candidate has a plan. The President's put forward proposals. We just can't seem to get the Congress to focus on it. We'd like to get the SCHIP reauthorized and move on to the larger debate of how we can get every American to have access to
Secretary Leavitt mentioned a couple
policy.
numbers there, $83,000 in New Jersey.
There's not a single program in the country that has been authorized at $83,000.
Well, New Jersey would go up to $72,000.
It already is. It has been in place for 9 years. It was requested through the department that Secretary Leavitt leads under a Republican governor in 1999, Christine Todd Whitman, and it was reapproved for 9 years in a row. And the reason it was approved up to those limits is the fact that the cost of living in New Jersey is far higher than it is in other parts of the country, and it was seemed reasonable, I think, to both Republican and Democratic administrations to give what they call a waiver, and that occurred. Now, the fact is that there's only about 3% of our kids in that 300% of poverty to 350%.
Middle class to upper middle class.
Upper middle class, hardly upper middle class in New Jersey. The median income is about $65,000. The reality is that the vast majority are of the children that are in the CHIPS program, we call it family care in New Jersey, are under 250%.
But here's what the Wall Street Journal said about your program in New Jersey. There's an editorial called Garden Statism, and you're actually suing the federal government over their plan. Their response is, how fitting that Mr. Corzine should be the one to resort to law-breaking, given that his state exemplifies everything that's gone haywire with SCHIP. States like New Jersey have been taking advantage of SCHIP's flexibility and covering more affluent children, their parents, and even childless adults. And President Bush this week said that New Jersey actually pays more under SCHIP to adults than children.
Well, this is the problem with this whole debate. There's so much misinformation. We cover parents up to 133% of poverty. That's $27,000 for a family of 4. In New Jersey, that is poverty. Matter of fact, people earn the earned income tax credit there. We're giving money back because they don't have enough resources to be able to get by in the world today. Yes, the cost of insurance for adults is more than for young folks, for kids, but that is not going to middle class or even moderate income families. Very low income. It's an extension of Medicaid, and the percentage of young folks, kids that are insured is 10,000, is about 3%. It's 10,700 of the total of 125,000.
And Secretary Leavitt, the Congressional Budget Office did report this week that about 80% of the children that would be covered by this expansion are eligible for either Medicaid or SCHIP right now, and that 2/3 wouldn't otherwise have health insurance.
That's the point. There are half the money right now in New Jersey goes to adults. And so under this program, what we would be doing is, rather than take care of the tens of thousands of New Jersey and other state children who don't have health insurance, we begin to go off to those who make $70,000, $80,000 and say to them, cancel your private insurance and we'll have the government pay for it. 1/3 of the people, 1/3 of the children.
It's only a
who would be
third,
covered.
though.
But that isn't progress. If you take the 4 million people that they suggest will be covered here, half of them already are eligible. They could sign up today. Now, I've been governor. I know it's hard to go find those children, but we ought to be putting low-income children first before we go off and have people cancel their private insurance and buy government
Respond to
insurance.
that point.
First of all, in New Jersey, since I've been governor, it's about 20 months, we've signed up 100,000 children, and less than 2,000 of those are in this 250 to 300,000 range. We can't find a single one of the individuals that we've signed up in that grouping that actually left a private sector program to come into SCHIP. Why would anybody drop a family coverage so that they could pick up only child coverage if they didn't have insurance? If they had insurance, why would they drop employer or any other coverage and move to SCHIP? It just doesn't make any sense.
The Congress's own budget office says that if this legislation, the legislation that the president has vetoed, becomes law, that over 1 million people will do just that. And they'll do it because if you say you're making $70,000 a year, you're paying for your own insurance, cancel it and come over and we'll have the government pay for your children's health insurance. That's an easy sale. And then we call it progress. That isn't progress. We ought to be putting poor children first, before adults, before middle-income families, and certainly before children who are in middle-income families who already have insurance.
One factual thing. For 6 years in a row, the state of New Jersey went to the Bush administration, now under Secretary Leavitt's leadership, and asked for a waiver for up to 350% of poverty.
So they were supporting this.
They supported this. This is not like we conjured this up. Under the Clinton administration, under the Bush administration, for 6 years, they approved the nature of the program we have. And we were following the principle of poor kids first. We have 500,000 children in our Medicaid program. We have the vast, vast majority of our children in the SCHIP under 250% of poverty. But when there is a situation between 250 and 350% of poverty, there's only 10,700 kids out of about 625,000 we have insured. The fact is they have to use a private sector HMO. They have to pay premiums. They have to pay co-pays. And that's what we went to the CMS to ask for their waiver.
Why
they
the
gave
switch,
it to
Secretary Leavitt? As far as I understand it, the Health and Human Services had approved waivers for New York to go up to $83,000, for New Jersey to go up to $72,000 until just this summer. Why the switch?
Well, first of all, the waiver was granted under the Clinton administration in the last 2 days, but the point here isn't, we've tried this. And what we find when you mix on the children's health insurance plan, children with adults, all the money gets used in adults, and half the money, 55% of the money in the governor's program goes to adults. And there are still tens of thousands of children in New Jersey and in other states. There's 500,000 of them nationally who don't have health insurance. We ought to be putting those children first, before adults, and before middle-income families who have insurance.
We've seen the parameters of this debate. I want to know what the prospects are for moving off it and actually seeing if there's going to be a deal going forward. The president yesterday did signal some flexibility in his radio address that he might be willing to give more money. Does that answer the objections?
George, from my point of view, I hope the Congress overrides the veto. We need new money, $14 billion by most estimates, just to stay even, just to keep the kids that are already insured. President's only asked for $5 billion over the 5 years. 14 to stay even, to grow this program, including, by the way, for poor children at the low end of the income scale. You're going to have to add money beyond it. I hope that we have the moral courage to override that veto. 43 governors, 67 senators, and a vast majority in the House of Representatives, bipartisan on all sides, think we ought to renew this at the level that the Congress has passed. I hope we override the veto before we start worrying about compromise.
Everybody wants children to have health insurance. The president wants this to be reauthorized, but we need to have a serious conversation here about the priorities. The president and no one in his administration has been part of this debate. This is the way Congress and the president often conduct debates. We were talking earlier, this reminds me of welfare reform 10 years ago. The Congress, then Democrat, sent a Republican, then sent a Democrat president. It had to be vetoed twice. We got back together, had a conversation, and passed a historic welfare reform. Now, the president has already said, I want to compromise. I want to cover poor children first. I want to do it before adults. I want to do it before middle-income children. If it takes more money, we'll put it up. But let's get together, pass the bill, and then get on to a bigger conversation about how we get all Americans insurance.
Guess we're going to have to get through an override.